I've spent over 3 decades studying the brain, not just the textbook diagrams or the crisp MRI slices on a screen, but the lived, breathing miracle that sits behind every word you speak, every memory you hold, and every step you take. And after all these years, what still humbles me most is not how much we know, but how much we still miss. Especially when it comes to aging. You see, aging is not a gentle slope. It is a landscape of sharp turns, silent storms, and moments where your own body starts whispering truths you were never taught to hear. And sometimes, it's not even the illness that gets you, but the thing you trusted to keep you safe. Let me tell you something that still makes my hands pause before I sign a routine order. There is a medical test, several, in fact, that seem harmless. Standard. Even wise. But for older adults, these very procedures, performed with the best of intentions, can quietly shift your brain's delicate chemistry, raise your blood pressure, and in some cases, trigger a stroke within hours. I'm not telling you this to scare you. I'm telling you this because too many families come to me after something has already gone wrong. After the mother who was sharp and smiling on Monday is suddenly slurring her words by Thursday. After the grandfather who just wanted answers about his stomach pain now struggles to lift a fork. And each time, I ask, what changed? And too often, the answer is this. Oh, he just had a routine scan. The most dangerous stroke is not the one you fear. It's the one you don't see coming. Let's talk about something that happens in nearly every hospital, every day: a CT scan with contrast. A small a warm flush, a picture of your insides made sharper. It sounds helpful. And in many cases, it is. But contrast dye, especially in older adults with high blood pressure, fragile vessels, or slowed kidney function, can quietly push your system to its edge. That injection can trigger a vasovagal response, heart rate dropping, blood pressure plummeting. Or worse, it does the opposite, spikes your blood pressure, tightening blood vessels already burdened by age. It's not a question of good or bad. It's a question of context. Of asking, is this test vital for me, right now? Or is it just part of a protocol? Because your body is not a protocol. I remember a patient, we'll call him Frank. 81 years old, still driving, still making his own breakfast each morning. He had some stomach discomfort, nothing alarming. His doctor sent him for a CT with contrast, just to be safe. The scan? Normal. The outcome? Anything but. 2 days later, Frank's daughter found him confused, one side of his face drooping. A stroke. The kind that creeps in through the back door. And the irony? The scan didn't reveal anything dangerous. But it may have caused something that was. We don't think about the body's balance, how thin the line is between function and failure. Especially in the brain, where blood flow is everything. Disrupt it, and you disrupt everything. That's why if you are over 60, and especially if you have high blood pressure, diabetes, kidney issues, or a history of heart disease, before any contrast scan, you must ask, is this truly necessary? There are often safer options: a non-contrast scan, an ultrasound, or even waiting a few weeks to monitor symptoms. Protecting your brain doesn't always mean finding more problems. Sometimes it means avoiding the problems we create ourselves. Another test that raises concern: the treadmill stress test. It sounds harmless. Strap on a monitor, walk on a treadmill, let your doctor watch how your heart behaves. But if you are over 60, and especially if you're not in top shape, this can be more than just a test, it can be a trigger. Imagine this: you've been sitting in the waiting room, calm, quiet. And then suddenly, your body is asked to perform. Heart rate up. Blood pressure soaring. Fragile arteries pulsating against new pressure. And all of this, in a body that may already be carrying decades of wear. It's like testing a classic car engine by slamming on the gas. There's a patient who stays in my memory. Margaret, 74, from Ohio. Lovely woman, deeply loved by her family. Her doctor ordered a stress test, not because she was having symptoms, but just to see. Halfway through the treadmill portion, Margaret became dizzy. Her heart fluttered. They stopped the test, monitored her, sent her home. The next day, she had a minor stroke. It wasn't the test itself that caused it, but the strain. The surge. The invitation to stress a system that was quietly compensating until it couldn't anymore. We are taught that catching problems early is the goal. But we must also learn that provoking problems isn't prevention. It's harm. There are safer ways to examine the heart. Nuclear stress tests that simulate exercise through medication. Echocardiograms at rest. Holter monitors that observe your rhythm over 24 hours without making your heart race. None are perfect. But they are safer for the vulnerable. Especially when there are no symptoms, no chest pain, no shortness of breath, no new fatigue. In those cases, always ask, why this test, now? Because your brain, your heart, your body, they all work harder than you realize just to keep things in balance. And when we demand too much, too fast, we risk tipping that balance in ways that are hard to undo. Now, consider another test you might be offered, an endoscopy or colonoscopy. Routine after 60, right? Look for polyps, catch cancers early. But there's something no one mentions in the brochure. Sedation. For most endoscopic procedures, you're given drugs to relax or sleep. And while that makes the procedure easier, it also slows your body down, your breathing, your circulation, your blood pressure. In a young, healthy adult, that's usually fine. But in someone older, taking medications like blood thinners, heart pills, or even aspirin, it's a cocktail of risk. Sedation lowers your blood pressure. Blood thinners reduce your ability to clot. Put them together, and the door opens to something we call a transient ischemic attack, a mini stroke. The kind that doesn't leave a scar on your scan, but one you feel in your speech, your balance, your thinking. Sometimes for a few minutes. Sometimes forever. There's a study I share with families often, published in Gastrointestinal Endoscopy in 2021. It found that in adults over 65, sedated endoscopies were linked to a rise in stroke-like events within 72 hours. Not dramatic, not visible to the eye, but signs that blood flow to the brain had been disrupted. Just enough to leave a mark. I remember a woman, Diane. 76. Healthy. Sharp as a tack. She went in for a colonoscopy, sedated, as usual. 2 days later, her husband noticed she was slurring her words. Confused. At the ER, she was diagnosed with a mild stroke. It wasn't severe, but her confidence never returned. I used to feel so steady, she told me. Now I second-guess every step. That's what we don't talk about enough. The aftershocks. The way a moment of medical risk can ripple into months or years of fear, fatigue, and feeling not quite right. So please, before you say yes to a procedure with sedation, ask your doctor, do I need this now, or can we wait? Can it be done without sedation? What are the risks given my medications? And if you're on blood thinners, be extra cautious. Because a stroke doesn't always come from a clot. Sometimes it comes from a cascade. And sometimes, from a test we didn't question. When I speak to families about stroke, they often imagine the dramatic kind, the sudden collapse, the slurred speech, the ambulance sirens echoing through a neighborhood. But some strokes don't arrive like a thunderclap. They arrive like mist. Subtle. Lingering. They creep into your life through dizziness, fatigue, confusion, a quiet shift in who you are. And one of the lesser-known triggers? A test that began with good intentions, the MRI with contrast. MRI scans are miracles of modern imaging. They allow us to see what the naked eye never could: tiny lesions, subtle tissue changes, early signs of disease. But to sharpen those images, we often inject a contrast dye. And that's where older adults must pay close attention. The contrast used in MRIs often contains a substance called gadolinium, a rare earth metal designed to pass through your body swiftly. But in seniors, especially those with declining kidney function, a condition more common than you think, the body doesn't always clear gadolinium the way it's supposed to. It lingers. And when it lingers, it may settle in tissues, in joints, even in the brain. One study in the journal Radiology followed over 2,000 patients aged 65 and older who received contrast-enhanced MRIs. Within a week, 5% reported symptoms: blurred vision, lightheadedness, difficulty concentrating, strange headaches. Not full strokes, but close. Micro disruptions in the brain's circulation. Enough to feel frightening. Enough to rob you of clarity, of confidence. And here's the problem: many of these patients had no idea their kidneys were even compromised. Take Harold, 79 years old, a retired carpenter. Proud, fiercely independent. He came to me after an MRI with contrast. "I don't feel right," he said. "It's like my head's in a cloud." We ran labs. His GFR, a marker of kidney function, was low. Stage 3 chronic kidney disease. No one had checked it before the scan. And now, we had a new mystery: had the dye triggered the symptoms, or simply unmasked them? Either way, the result was the same. Harold lost a week of his life in a fog and months rebuilding his sense of strength. This is why, before any contrast-enhanced MRI, I urge every older patient, ask for a kidney function test. It's a simple blood draw. A precaution that can mean the difference between clarity and confusion. And ask your doctor, can this scan be done without contrast? Often, the answer is yes. Or at least, not yet. Let's try another approach first. Because in medicine, the best decision is not the most aggressive one, it's the most informed. Now let's talk about something even more deceptively benign: the carotid artery ultrasound. This is a scan of the neck arteries that feed your brain with blood. Non-invasive. No needles. No dyes. Just a simple scan, often done just in case. But here's the trap. If you're over 60, it's common to have some narrowing in these arteries. A bit of plaque. Some thickening. It happens with age. But not all plaque is dangerous. And not all narrowing means you need surgery. In fact, in the absence of symptoms, no dizziness, no vision changes, no weakness, the risks of intervening may outweigh the benefits. I remember Helen. 82, spry and witty. Her doctor recommended a carotid ultrasound during a routine physical. It showed 65% narrowing. "Not terrible," they said, "but we'll send you to a surgeon." Within 3 weeks, she was on an operating table for a carotid endarterectomy. She suffered a small stroke during the procedure. Now she walks with a cane and slurs some words. And every time I see her, she asks, "Would I have been okay if we had just waited?" It's a question I can't answer with certainty. But what I can say is this: the New England Journal of Medicine published a landmark study following over 3,000 seniors with moderate carotid narrowing but no symptoms. The conclusion? In most cases, medication and lifestyle changes were just as effective as surgery in preventing stroke. And the surgery itself carried its own risks, including strokes caused by the procedure. We must remember, when you cut into a vessel that feeds the brain, the margin for error is razor thin. So, if your doctor suggests this scan, ask, why now? What happens if it shows narrowing? Are we prepared to act or just to worry? And if you've already had the scan, and it shows plaque but you feel well, ask about monitoring. Repeat scans in 6 months. Lifestyle changes. Medication. Don't rush toward a blade unless it's absolutely needed. Because the body, especially after 60, is not just a machine. It is an ecosystem. And when we disturb one part, the ripple touches everything else. This brings us to the most overlooked variable in all of this: the emotional toll. What no test measures, and yet what every patient feels, is the weight of fear. The stress of uncertainty. The subtle panic that comes from being told something's not quite right without a clear answer. This emotional tension raises cortisol levels, affects your sleep, your digestion, your immunity, and yes, your blood pressure. And when your blood pressure rises silently, steadily, it primes your brain for rupture. I've seen it happen. A woman comes in for a scan. The result shows incidental findings, maybe a small nodule, a minor vascular irregularity. Probably nothing, the doctor says. But now she can't sleep. She Googles. She waits for follow-ups. Her anxiety grows. Her blood pressure creeps upward. And within days, she's back in the ER, dizzy, pale, one side of her face sagging. Was it the scan? The dye? The stress? Often, it's all three. The modern healthcare system is built on the idea that more information is always better. But for the aging brain, information without interpretation becomes noise. And noise, when it grows loud enough, can trigger a fall, a stroke, a collapse. That's why we must change the question from "what test should I get" to "what do I need to feel whole, strong, protected?" Sometimes, it's a scan. Sometimes, it's a pause. Because your health is not a puzzle to be solved. It's a story to be respected. And part of that story is the invisible work your body does every day to keep you steady, the silent coordination between brain and blood, nerve and vessel, breath and rhythm. The miracle of waking up each morning with your thoughts intact, your legs still strong, your memories still yours. That miracle is not guaranteed. But it can be guarded. And we guard it not with fear, not with constant surveillance, but with wisdom. Wisdom means asking, is this test for me or just for protocol? Wisdom means knowing your medications, your risk factors, your options. Wisdom means trusting your body enough to speak up, to slow down, to say, let me think about that before I schedule it. Because when you do that, when you take your seat at the table of your own healthcare, you're not just a patient anymore. You're the author of your outcome. There's a moment in every doctor's life, usually quiet, often unexpected, when the white coat feels heavier than usual. Not because of the hours, not because of the responsibility, but because of a conversation. A single one. Mine happened in the hospital hallway, late one evening. An older gentleman, Mr. Ellis, 84, former math teacher, once an avid chess player, had just suffered a stroke. A small one, thank God, but enough to muddy his speech, slow his steps. His daughter was sitting by his side. She looked up at me and said, with tears welling in her eyes, he just had a checkup. Everything was fine. He felt great. Why did this happen now? And I couldn't bring myself to tell her the full truth that night. That just days before, he had undergone 3 routine tests. One with contrast. One under sedation. One that spiked his blood pressure. Each small on its own. But together, they may have been the storm. He didn't need all of them. Not then. Not with his history. But no one stopped to question. No one asked if Mr. Ellis, the man, not the patient, was ready. I share this not to place blame, but to open a door. A door into a more conscious way of aging. Because after 60, your body speaks in a different language. It doesn't always shout. Sometimes it whispers. It slows down not from weakness, but from wisdom. It conserves, it protects, it adapts. And if we try to treat it like it's still 30, we often do more harm than good. There's dignity in caution. There's power in pause. I want you to understand this: you are not fragile. You are refined. You are not past your prime. You are standing in a sacred chapter, one where clarity, courage, and calm must guide your medical choices. We live in an age where information floods us. Test this. Scan that. Prevent. Detect. Intervene. But prevention doesn't mean pushing the body to reveal every secret. Sometimes it means preserving what's already working. Aging gracefully is not about doing more. It's about doing what matters most. So let me speak plainly now, to you, or to someone you love who's crossed that invisible threshold into their 60s, 70s, 80s. Before your next test, ask yourself: do I feel symptoms that concern me? Has my doctor explained why this test is necessary right now? Am I being tested because it's truly needed or because it's on a checklist? And if you don't get clear answers, ask again. Or wait. Or seek a second opinion. Because stroke doesn't always look like it does in the movies. It can be subtle. It can be slow. A little fogginess. A bit of imbalance. Trouble finding the right word. And by the time we connect the dots, the damage is done. But when you start asking better questions, when you understand how your medications, your hydration, your sleep, your stress all impact your brain's ability to heal and resist injury, you reclaim your power. This is not about saying no to modern medicine. It's about saying yes to thoughtful medicine. And thoughtful medicine looks like this: knowing your blood pressure numbers and keeping them in range with food, movement, and rest. Checking kidney function before any contrast dye enters your veins. Reviewing your medications before any sedation, even for the easiest procedures. Speaking up if you feel rushed, uneasy, or uncertain. And above all, treating your brain like the irreplaceable organ it is, one that cannot be transplanted, rebooted, or replaced. Do you want to protect your brain? Begin here. Eat with intention. Cut back on processed sodium. Add berries, greens, olive oil, and wild-caught fish. Sleep like it's sacred. No less than 7 hours. Your brain clears toxins at night. Walk. Every day. Even 10 minutes. Movement is the music of memory. Stay hydrated. Dehydration is a silent thief of cognition. Manage stress not just with pills, but with breath, nature, and moments of stillness. And challenge your mind. Read. Write. Learn. Speak. Connect. Your brain thrives on meaning. And when a test is offered, pause. Not to refuse, but to reflect. You have time to decide. You have a right to ask. You have the wisdom to weigh risks and benefits. Because what you are protecting isn't just your arteries or your blood flow. You're protecting the very thing that makes you, you. Your memories. Your wit. Your stories. Your music. The way you cradle your grandchild's hand. The sound of your voice when you hum your favorite song. That's what's at stake. And no test, no matter how routine, should ever threaten that without just cause. So the next time you sit in a doctor's office, and they offer a scan, a stress test, an endoscopy, a dye, a sedation, a screen, look up. Look them in the eye. And ask with strength and grace, "Doctor, will this test help me, or might it harm me?" And let their answer guide your choice, not their habit, not the protocol, not the fear. Because this stage of life you're in? It's not the closing act. It's a sacred one. One that deserves every ounce of respect, care, and consciousness. You are not here to be scanned. You are here to be seen. You are not here to be rushed. You are here to be heard. You are not here to be managed. You are here to be honored. So honor your body. Honor your brain. And let your health decisions reflect the deep dignity of the life you've lived. Because aging is not a decline. It is a declaration that your story is still being written. And you, my friend, still hold the pen. If this message touched your heart, if it made you pause, reflect, or feel seen, then let this be the beginning of something new. Subscribe now to Healthcare, where aging is not feared, but understood. Where every video honors your wisdom, and every truth helps you protect it. Because your health is your story. And your story deserves to be told with care. You're not alone. We're in this together.